Welcome back to our discussion today on anti-aging and skin conditions. Let's go now to Sandra on line 8. Hi, Sandra, you're on the line.
Hi. My question today is, what causes age spots and how can we get rid of them?
Very good question. Dr. Meschino.
That's a good question. We think that age spots occur from an accumulation of free radical damage, whereby the damage is so extensive by free radicals, often smoking, alcohol, or sunlight, or a lack of defense against those things, that all of a sudden all the inside of the cell becomes so damaged that all of this sort of fatty, waxy material is released, and it becomes a permanent fixture now on the skin. And you can't change that by taking supplements. What I can tell you is that in the last 2 years, I met a medical doctor from Romania who also has degrees in acupuncture and homeopathy. She's developed a topical skin cream. I don't talk about it in the book because when I wrote the book, I didn't even know this existed. But she's developed a couple of homeopathic formulations, one of which actually reduces aging spots on the skin quite remarkably, and the other one is very effective at getting rid of stretch marks. And there's one that's actually sensational that reverses cellulite to a very significant degree. Things that I used to tell people there's nothing you can do about it.
Yes.
So she comes with a different type of knowledge from Eastern Bloc countries, studied also in Asia with the monks, and uses herbs I had never seen before, and absolutely has a few little topical products that are sensational.
Wow, so it's still being worked out before these things are available widely on the market?
The cellulite cream is now in the marketplace in health food stores in Canada, and it will be released into drugs in mass across the country under the name, I believe it's going to be called Alpha Cell. And it's remarkable for cellulite, and it's not something I developed, but she has 2,500 case studies. The before and afters are incredibly good, and there's a rationale as to how it works. But she has one also for age spots that we're looking at now, and it might come into the marketplace sometime next year.
Wow, very interesting. Let's go now to Audrey on line 7. Hi, Audrey, you're on the line.
What would you recommend as a sunscreen for young people, particularly children?
Well, I haven't looked closely enough at name brands. You know, the thing about sunscreens that gets a bit scary.
Yes,
is that
and I've heard this.
Yes, some of the chemicals in sunscreens, when they're tested on animals, because whatever you put on your skin has the chance of going through the skin into the bloodstream.
Largest organ of your body.
Yeah, now it's in the blood, and now your liver has to detoxify it, and what are the end products of that? Some of those chemicals are now linked to possibly being carcinogenic. I don't want to scare your viewers and say that
but it's
sunscreens.
not the first time I'm hearing this, Dr. Meschino.
So there may be an association that some of these sunscreen chemicals actually are associated with increased cancer risk, although studies aren't saying that yet in humans. But I can't say here's a brand of a particular sunscreen where the chemicals are all completely safe and completely natural. I know that companies are now trying to work on that type of a sunscreen. I don't believe it exists yet, or I haven't seen it. In the meantime, what do I use? I'll use a high SPF sunscreen at least a 30 level, and you know, I'm Italian, I have olive skin. The chance of me developing skin cancer is less than many people who say have red hair and freckles and white skin, but I'm going to tell you that for all of us we're at risk. And so I use a 30 SPF, and I would say at least a 30 to a 45 on a young child makes a lot of sense. And I would try to keep them with a shirt on, some kind of protective clothing if I could as well.
Okay, let's go now to Janet on line 4. Hi, Janet, you're on the line.
Yeah, good afternoon. I love your show.
Thank you, Janet.
I was wondering, you mentioned psoriasis, if the doctor had any suggestions for dealing with scleroderma?
Scleroderma is a huge one.
Do you know, I recently had to review this because some of the doctors that we deal with have emailed me saying, I've got a patient with scleroderma.
It's becoming more prevalent.
Seems to be. So I do actually have a nutritional protocol for it, which I could possibly email to you. If you emailed me, can I do that?
Yes.
At jim@adiva.com. So if they see the website, they'll see how to spell Adiva. Just jim@adiva.com. I can send you that nutritional protocol for scleroderma that makes sense from a biological plausibility standpoint, and hopefully it will slow down the progression for you.
Now, I just want you to make just an overall general statement here, because I know that scleroderma falls under the category of the autoimmune diseases. In your book, The Optimal Living Program, you talk about 7 steps to a healthy, fit, age-resistant body, but at the same time, this is a book that really examines the overall health of an individual, detoxifying your liver, going on the proper diet, nutritional meals. And the thing is, when you look at something like that, it can't help but help, no matter what condition you have, along a healthy lifestyle. So do you want to address this at all, the overall health of an individual when it comes to diet?
I appreciate you saying that. My experience with patients has been that, regardless of what health condition they're showing up with, the 7 steps in that book are the first place that I start with people.
Yes.
And if you just give it to everybody all at once, it's overwhelming to make lifestyle changes like that. So you really have to.
But it's an encouraging book, because it's not presented in an intimidating way.
Thank you. What I've tried to do in the book is what I've done with my patients. You take them by the hand and you say, let's take the first step together. How does that feel? Working out the bugs? Okay, let's take the second step together. And people can make lifestyle changes slowly over time. And there's no need to throw it all at them in the first day. Let them just gradually ease into the things and see results. And as they go through the 7 steps, it maximizes their overall health potential. They realize that this book is realistic. It's a book...
And user-friendly.
It is? You think it is? I mean, when I'm writing it, I think it is, but it's
You're a
hard to know.
scientist, so sometimes people might think, well, maybe it's loaded with scientific jargon. It's not. It's user-friendly.
Thank you. I mean, I had so many, I've had to explain this in layman's terms for, 20 years or so. So the idea is that if they put those changes in, that it helps to lower cholesterol and bring your triglycerides down. It'll have an effect on blood pressure and reduce your risk of diabetes.
Right.
If you have diabetes, it'll function. So you'll have less osteoporosis. If you already have it, it'll slow down the progression. It'll strengthen your immune system. So it really is all-encompassing to a large degree.
Well, you explained that certainly very well. We're going to go for a break and get back to you on the phone lines after this. Stay tuned.